This video will provide 2 examples of goals that are easy for you to understand, and then 1 example of a hospital goal for a hospital patient that will help you understand what your instructor is looking for. So a goal such as this: I will study after work every day. This may seem like a pretty good goal to someone who is not experienced in writing SMART goals. But when we think about SMART goals, we have to think about what each letter stands for to determine if you have written a SMART goal on your care plan. Go through each letter of SMART and determine if your goal meets all of what those letters mean, such as S. S means, is it specific? I will study after work every day. Is this specific? What will you do? Study. After work every day is when you will do it. Let's hold on to that. It may be, it may not be. M means measurable. Can we measure this goal? Meaning, can we get out a measuring tape and measure something by a scale, or can we count something? I will study after work every day. Every day. We can count days. 1 day, 2 days, 3 days. So of course, okay, so it's kind of measurable. Is it attainable? The goal is saying that I will study after work every day. Do you want to set yourself up for failure? What if you don't have a good day and you don't feel like studying? Also, how long will you study? So, ding, ding, ding. It's not very specific now, is it? It doesn't say how long you will study. Maybe this goal is attainable if you were to say, I will study for at least 30 minutes after work every day. It's only 30 minutes. So then it would be very specific because you're saying how long you will study. And it will also be attainable because it's 30 minutes. It's not leaving anything to the imagination. R means realistic. Is this realistic? What we have here, I will study after work every day. I'm going to have to say it's not very realistic because there's no time to it. Now, if it said I will study after work every day for at least 30 minutes, that's pretty realistic. Now, if it said I will study after work every day for 3 hours, that would not be very realistic. And is it timeable? Timeable means, can we have a deadline to this? I will study after work every day. Every day such as what? Every day for the rest of the program? What do you mean? If it said every day to the end of this semester, then it would be timeable. This is not a SMART goal. Next, we have another example of a goal that someone who has not experienced writing SMART goals may think is a good goal. I will not go out anywhere this semester. Let's dissect it to determine if this is a SMART goal. S, is it specific? I will not go out anywhere. You're not going to go anywhere. Okay, so you're being pretty specific. I'm not going out anywhere this semester. Okay, let's hold on to that specific. Is it measurable? Can I measure this? I will not go out anywhere this semester. I don't see how we can measure this. If maybe it said, I will not go out for 15 days, maybe it would be measurable at this point, but I'm going to say that it's not measurable. Is it attainable? I will not go out anywhere this semester. How attainable is this? Whenever you write a goal, you do not want to set yourself up for failure, and you do not want to set the patient up for failure. So how realistic is it that you're not going to go anywhere this semester? So if you get sick, you're not going to leave the house and go to the doctor. You're not going to leave the house and go pick your child up from daycare or school. You're not going to pick your child up from the babysitter. You're not going to go to school if you are in a RN program for 2 years or a BSN program and have no LPN experience and you need to go to clinicals. So already this goal is setting someone up for failure. It is not attainable. Next, R, is it realistic? Is it realistic to say that you are not going to go out anywhere, nowhere at all for this whole entire semester? That's leaving too much room for failure, and you don't want to do that in a goal. So that right there lets you know that this is not realistic. It's not realistic at all. It leaves too much room for you to fail. Is it timeable? I will not go out anywhere this semester. So yeah, we can use the calendar on our phones, or we can put a calendar on the wall and draw a line through every single day of the semester and be like, I can measure this. I got 4 more days in the semester left. It's timeable, okay? It's pretty timeable. There's a deadline to this. It's pretty much what timeable means. There's a deadline. I will not go out anywhere this semester. It doesn't say for the rest of the program or anything, but it says this semester. So there is a deadline. When you're determining if a goal is timeable, you need to determine if there is a deadline. And the deadline here is semester. Even though there's a deadline and it is timeable, this goal is not smart. This is a silly goal. This is not a smart goal. So you do not want this goal. It's not specific enough. There will have to be lots of changes that we will have to do to this goal to make it smart. We can improve this goal by going through each letter and changing some things to make it specific, to make it measurable. Maybe just say that we're going to go out maybe 10 days out of the month of May, maybe something like that. We can go through and change some things, but as it is written right here, this goal is not smart. It's just silly. Finally, we have a goal that you can use in a care plan regarding a hospital patient. Let's determine if this goal is smart by going through each letter of the word smart. Patient will verbalize at least 2 foods high in iron before length of stay, day 4. Length of stay means how many days has this patient been in this hospital, okay? So let's go through each letter. S, is it specific? What do we want the patient to do? We want them to verbalize, okay? Verbalize what? At least 2 foods. What type of foods? High in iron. When do we want them to do this by? Before length of stay, day 4. Okay, so you know what? This sounds very specific, very thorough, okay? Is it measurable? Can we measure this somehow? And yes, we can. One thing that you can look at quickly is if you have some numbers somewhere. That means that you can count something. We want the patient to verbalize at least 2 foods. Can we measure how many foods they verbalize? Yes, because we can count 1 food, 2 food, okay? Okay, so it is measurable. Is it attainable? Patient will verbalize at least 2 foods high in iron before length of stay, day 4. I think that's attainable. We're not asking them to verbalize 10 foods. We only want 2. So it's very attainable. Is it realistic? Can the patient realistically meet this goal? Patient will verbalize at least 2 foods high in iron before length of stay, day 4. We're not saying on day 1. We're not saying on day 2. We went all the way to day 4. We're giving the patient time. And we also want them to only verbalize at least 2 foods. It's just 2 foods from the education that we provide to them. So this is very realistic. Now, is it timeable? When do we want this done by? To determine if something is timeable, you must determine what is the deadline for this patient to reach this goal. And here we have it written. Patient will verbalize at least 2 foods high in iron before length of stay, day 4. It is timeable. We want this done before day 4 that the patient has been in the hospital. Therefore, it is timeable because we have a deadline written here. This is the only SMART goal that you are currently looking at. This is what your instructor wants. Each time that you write a goal for your care plan, go through each letter of the S. Make sure It is specific, measurable, attainable, realistic, and timeable. Don't forget to subscribe, like, and share.